All right, wonderful. Welcome, everyone. Good evening. Welcome to the breakout session, The Future of School-Based Telehealth. My name is Lieutenant Commander Jenna Cope. I am a public health analyst at the Office for Advancement of Telehealth at HRSA, or again, some of you may have heard it mentioned today, OAT is what it's fondly referred to as. I'll briefly introduce our speakers today, and then each of our speakers is going to open up the session to share a brief overview of their work in their organization, so everyone has a background on their work. After the brief overviews, we'll transition to a roundtable discussion with some Q&As. We will plan to take questions after the overview that the speakers will do, and during the roundtable discussion, we will also take questions. I know some of you are in the room, and there are also several online as well, so we will be doing that hybrid approach to Q&As. We would welcome you to ask any questions that you might have by using the Q&A box in the virtual event platform that I'm sure you've been using all day. Like I said, we have three incredible speakers today, each with phenomenal experience and a real passion for telehealth. Please do remember, I'll briefly introduce them, but I know it's a matrix tradition not to do full bios, but their full bios are on this session and the conference website if you want to see more about all of their experience. So our first speaker is going to be Ilana Wells. She serves as the telehealth manager for grant initiatives at the Medical University of South Carolina Center for Telehealth, Division of Research and External Affairs. We also will have Amanda Martin North. Amanda is the executive director of the Center for Rural Health Innovation. And then Brittany Azalina who is the founder and CEO of Virtual Counselor and College Telehealth. So again, we have a great session today. I know we are closing out the day today, but I'm going to turn it over now to Ilana to kick us off with her 1 to 2 slide overview.
Thank you so much, and so nice to be here. You can go ahead and move to the next slide. So I know, MUSC is a National Telehealth Center of Excellence, and this is our disclosure slide. So I'm just going to give a little background about the MUSC Center for Telehealth. So this slide really shows the history and growth within telehealth at MUSC and in our state. And we really can trace telehealth to starting in around 2005. With a maternal fetal medicine initiative, as well as some other telehealth going on, including telestroke, tele-ICU, and then a little later on, a pilot school-based telehealth program. And in 2013, all of these various telehealth efforts across MUSC were really combined under the MUSC Center for Telehealth. And funding was given to MUSC to build telehealth programs that would serve the state and really distribute funding to partners. And this was really due to the fact that our state during this time chose not to expand Medicaid. And so they were really looking for other ways to invest in increasing access to healthcare. And so this is when in 2014, the South Carolina Telehealth Alliance, or the SCTA, was founded. And the SCTA is really a consortium of many different organizations, including academic medical centers, community hospitals, local providers, including FQHCs, that have really come together to spread telehealth across the state. And MUSC is the administrative seat of the SCTA. And then in 2017, we were designated as one of 2 national telehealth centers of excellence, designated by HRSA. And we were selected partly because of our broad reach into rural communities, the fact that we had some mature telehealth programs that we were able to evaluate, and we had some examples of financially sustainable models. And then in 2019, in acknowledgement of our collaboration, we were awarded the American Telemedicine President's Award for the South Carolina Telehealth Alliance. And then, of course, in 2020, telehealth has changed due to the pandemic. And so we can go ahead and move to the next slide. And so as it relates to school-based telehealth, we've really used kind of data and public health to really inform our strategy in terms of expansion of school-based telehealth across the state. And so I know many of you at this point probably are very familiar with school-based telehealth, and we'll go into kind of more specifics in kind of our more discussion format. But I wanted to just share visually kind of the slide in terms of our strategy. So the map on the far left shows rates of ED visits due to asthma. The map in the middle is a map that was provided to us by the South Carolina Department of Education, outlining our outlining the priority schools. And then I just see myself here, but on the far right is a map of the reach of school-based telehealth in our state. And these are counties that are either delivered by MUSC or as well as other local provider and health systems that are delivering school-based telehealth around our state. And I'm looking forward to the conversation. We'll pause and turn it over to the next person.
Brittany's next. How about that? I thought it was me.
All right, guys changed up the order on me here. Can everybody hear me?
Oh, no, wait, just kidding. It is me.
Go ahead, you're up next.
Okay, so anyway, hi. I'm Amanda Martin North. I'm the Executive Director for Center for Rural Health Innovation here in North Carolina. And I went ahead and put up all the logos because I'm very proud of what we do. We're here mostly to talk about Health eSchools, which is our flagship program and the one that's been around since 2011. But it was working really well. And so in the last couple of years, we've expanded into Health eCorrections and Healthy Neighbors, which is everybody else who's not either at school or in jail. Anyway, we really like our convention and our logos. We just kept doing it. But what Healthy Schools is we're an organization that provides mostly medical primary care services into schools. We provide telehealth equipment to the school nurses, train them how to do it, teach them how to access us. And then when they have a kid with a need, they connect to us. And we can diagnose and prescribe and evaluate and CLIA-waive tests and all the important things that they need to be able to get back to the classroom as soon as possible, stay healthy and ready to learn, because we're all about the school-based healthcare model. So we're in North Carolina. We've been at it for 11 years, and we've been on a very slow growth trajectory, well, sometimes in bigger chunks, but we have a map. So the red counties are where we're located, and I have colleagues in the room. We all live in those red counties over there. But then we partner with organizations who I hope are at least online in the blue counties down east, where we're able to provide medical care in with partners who are local there. So we have a little bit of reach. These are all rural counties and primarily Title I schools, but we're in the Head Start right through community college age, although I would say most of our visits are coming from the more like elementary and middle school age. Yeah, and I think that's all I wanted to do for the introduction. So now you can hear from Brittany.
Hi, everybody. I'm Brittany Azzolina. I'm the founder of Virtual Counselor and College Telehealth. Virtual Counselor is an online mental health group platform. We focus on specializing in cyber schools, college partnerships, as you can see, supporting teens, adolescents. It is amazing to me to say that I started in 2013. I landed in a niche area and had the opportunity to partner with a cyber school in Pennsylvania, where I'm based out of. We have a lot of free public cyber charter schools in PA that have been around for 20, 25 years. And so when I landed in this niche area, being fresh and new, and there really was not a lot of information, I dug right into this organization, to the matrix, looking for resources. And since then, I've grown and I have clinicians in about 30 states. So I know there's a wide variety of representatives at this conference having to do with hospitals, large entities, and I kind of represent, a single person coming to these and growing. And that, you can get a lot of information from this, and hopefully I can share that with you. So the first program I started was the K-12 school telehealth program. And within that, this is for special education students. So when you have a cyber school, these students are all over the state and they're receiving their education in their homes. I created a need and I partnered with the school to kind of figure out how we're going to solve this problem. And since then, I still have the same contract since 2013 and have grown with them. Those services include counseling, group counseling, parent training. We are the implementers of the IEP, which is known as the Individualized Education Plan. And we fall, although we're licensed professionals, we fall under the Department of Education. We follow the guidelines for the state of Pennsylvania's educational component. That's the biggest part of what my company does. And then from there, we rolled into college telehealth, having a need. And I saw the need for the increased demands. These students are getting older. Where are they getting resources? And, as we see that, in college campuses. And so we also partner with colleges similar to an EAP model, in which we might be the overflow for the school. I have one college that has 13 campuses in the mountains in Colorado, in which we are the only counseling department they have. And so we have really individualized model that I've created with them. And then Explore Telehealth is more traditional outpatient model that you may see. And through that growth, if you want to go ahead and switch to the next slide. As you can imagine, here I am in 2013, cyber school and telehealth. There was no guidebook. And who would have known that I would have landed in the middle of COVID in this prime space that people are kind of scrambling and figuring out what to do here. So there's a sample of the providers that I have, some of the schools that I partner with. And I just wanted to show you a little bit of where I started in 2013 to where we are now, and continue to grow. And that's really organic. It's really organic growth that I've had based on the need of where we're at with the schools, and continue to grow from there. So I look forward to talking with everybody a little bit more and sharing more about what we do and how it might be helpful to you.
Excellent. All right. Thank you so much for Brittany, Alana, and Amanda, so much for just sharing a brief overview. I know it's hard to capture all that you do in just a few slides, but thank you so much. That gives us a little bit more context, so we can open it up to more of a roundtable. Just a reminder to everyone in attendance online or in person, if you can just enter in the chat any questions, but we're going to go through a few discussion questions, but we'd welcome any questions the audience has. For this first question, let's actually start with Alana, and we can go to each of the speakers. But telehealth has had such an exponential growth in the past 2 years, especially because of the pandemic. Have you had to adjust or scale any components of your program to reach more individuals or schools? And would you be able to talk a little bit more about that?
Yes, absolutely. Yeah, and I think just also to share kind of just high level a little bit about our model. We also with the school nurse's office with a telemedicine cart, and we have and we offer acute care and chronic disease management. And traditionally, when children are in school, we have a on-demand model for acute visits where the school nurse requests a visit and it gets an alert is sent out to our providers in the various pools. If the first provider doesn't, or if the first call pool doesn't pick up, then it'll roll, and we partner with local providers. So each district looks a little different. So how we had to really modify during the pandemic is the main thing we did was we offered a direct to consumer model where if a student was sent home due to having symptoms and they were excluded from school following the Department of Health and Education guidelines, then we were available for the parent to call to request a visit in the home, and they would be connected to the same school-based providers. So I think that's the main reason that the main kind of strategy we used to address COVID. I think just in terms of other ways that we've scaled, and I don't want to take up too much time, but one thing we did that I think was pretty powerful was we transitioned from paper consents, sending out to everyone each year to electronic consents. And that really allowed us to reach more students and kind of streamline our process. So I think I'll stop there for now.
Excellent. Thank you. Brittany, do you have anything to add on to that in terms of scaling up?
Sure. Yeah, absolutely scaled, because as you can imagine, the need for mental health, cyber schools boomed, and then the need for mental health within those is also continuing to grow. What I didn't realize is how well set up we already were. That was the pat on the back moment of great job, guys, because aside from the initial shutdown, we just dug our heels in. We have the established, everything we do is virtual, and the schools we work with are virtual, and the students and families are virtual. And so what we did is we had to grow with the schools. And if you can imagine, one of the schools I worked with had about 10,000 students across the state of PA. They have 22,000 now, right? They hired 300 people. So what we had to do is maintain consistency. And we had to dig into our own existing workflows to make sure that they were solid. As you can imagine, the scaling of staff and automating those systems. Because when you're working, I mean, many of you may have a hub. My hub is, we're all virtual. And so each one of us is a tentacle of our programs. And so me as the owner and the one that's generating these really has to build consistency and make sure that we're following through and we have systems in place. So that's part of scaling. Getting your automated systems in place. And we can talk about this a little bit further, but the cross-state licensure is something that's a real significant issue, more for the college students than it was the K-12, which we can talk about as we go on.
Excellent. Yes, licensure has especially been a very hot topic, something very important, especially as we consider future state, where is this going to go? Definitely a huge discussion area. I do want to kick it over to Amanda. Do you have any additions or any thoughts on expansion and scale?
Yeah, so one of the specific ways that we had to change and grow because of COVID. So part of our model is that about 5 years ago, we transitioned away from the cart in the school nurse office to a portable kit that the school nurse could take with her, because out of most of the schools we were serving, the school nurse covered more than one school. So if we wanted her to be able to take care, and there happened to all be women in our network, so apologize for the her. But for her to be able to, for this nurse to be able to take care of kids at both schools, we had to buy 2 carts, right? Because it wasn't portable. But once we switched to a kit that she could literally take with her from school A to school B, it cost a lot less to outfit 2 schools, right? And so now all these kids have access to care. Well, that was great, except that then when all the school districts suddenly started getting COVID money, they hired more nurses. And so now I had to buy a whole bunch more devices. Now, this is not the end of the world, but that was not money I had budgeted. And the schools were like, look, we hired 3 new nurses. Could you get 3 more of those nice little telehealth thingies for us? Without kicking any of that money to us to buy them, because that would have been nice, but they didn't. So I would say that was probably the biggest thing, that we just needed to be responsive because their situation was changing. And that, of course, does not speak at all to the fact that school nurses suddenly became really important people who got a lot of attention and a ton of work piled on them, and became the public health heroes that we always knew they were, but maybe the rest of the world didn't. So they were very, very busy folks for a long time, and they're finally putting their heads above water now. And they all have telehealth devices.
Excellent. Thank you. Yes, it's always so good to hear how much nurses have become even that much more appreciated through all of this. All right, thank you all. Just again, a reminder, if anyone wants to raise a question for the speakers, please enter it in the chat. And if there are any in the room, please feel free to let us know. For the next question, we'll start with Brittany on this one. We have been, as we mentioned, living in unprecedented times, and many of us have had to pivot to increase our flexibility, versatility. And we're curious do you have any specific examples of surprising creative interventions or problem solving that you've had to do? And if so, did it open any doors for additional possibilities for telehealth?
Absolutely. I feel like that just comes with the territory. That there's so many opportunities in telehealth that, we dive into something, at least I do, and navigate it as we go. I think I want to talk about college telehealth a little bit, because so that's really an area in which the colleges were really struggling to figure out what to do and figuring out how we're going to service these students. We're open, we're closed, we're in person, we're virtual. The kids are in different states. And so for that, the creative interventions is every program I have is almost like a pilot, every single one. Even though I have standards, it's how am I going to fill the need of what you have in particular? And so that created a little bit extra work, but customizing those things out for them, and creating things. At some point, I'd like to screen share some of resources that we have in what I've done, making everything digital and really making it streamlined, not only for our providers, because I'm also servicing and supporting the clinicians that we're all doing, that are providing their support to the families and the students, and putting in things like orientations for the faculty that we're working with at the schools, creating things called resource coordination sessions that we add on. The level of collaboration that we're doing is really where a lot of the intervention has come from, because we're trying to meet each other's needs there and looking at what the schools might need for that.
Excellent. Thank you so much. Yes, these past 2 years, there have been a lot of creative interventions that have come through. Alana, do you have any additions to add to that you all have done?
I think the main thing is just, we had to ensure that we were achieving goals of the visit. So for example, if a provider needed to know the height and weight of their child, kind of relying on the parent to use the resources that they have available in their home to help support those things. And I think that we really just kind of found that the direct to consumer model is just kind of like another tool in the toolbox for school-based telehealth.
Excellent. Wonderful. And Amanda, do you have any adds to this? Any creative intervention?
Thank you. I would give one example, which is that when the kids first went home spring 2 years ago, we were quickly able to follow at least some of them home with just a Zoom link, right? It was that easy to convert from the school being the site of service, or the school nurse's office, the school-based health center at the school to be the site of service, to switch to the home. And they had devices, and for the most part, they had some sort of internet access. And then we didn't see a huge volume of patients that way, but it did let our providers stay in touch with a few kids who especially were struggling to access care, because especially those first several months, the usual place of care, the health department, for example, were so overwhelmed with COVID testing and all that, they couldn't see the kid with head lice, but we could certainly talk about that over Zoom. So we found ways to use Zoom where we normally would have said, that's not good enough, right? We want the comprehensive, we want the otoscope, we want the stethoscope, we want to do a better exam than just Zoom. But we said, okay, Zoom's good enough for this, we'll take it. But what happened, and this is a cool down the road, and I just heard about this from one of my colleagues, that a kid at a middle school that we've been serving was on a field trip with school and had a really nasty case of poison ivy. And instead of mom needing to drive across the state to go pick them up, or end up in an emergency room with a big bill and disrupt the whole class and all this, they use Zoom to have our provider see the poison ivy and help advise on what to do. And it just sort of opened the door to think about how we can partner and think about how we can use what we have, and is it good enough? And you know what, it might be. It might be. So I'm pretty proud of that. I loved hearing that story just today about how that has continued to be something that we would have considered 2 years ago not adequate, not good enough, but now it is.
I think that's a great point of how can we approach a hybrid environment, just like this conference is doing, and just have it contribute to care for school children. We do have one question from the audience. This can be for any of the presenters and speakers. What underlying EMR platforms are you using? Is anyone using EMR platforms?
Yeah, well, since I don't have to unmute, I can answer. We run the electronic health record. We use Athena. which is, commonly available for lots of practices. But we don't run our telehealth encounters through Athena. We're using the device software to run the telehealth encounters. So those are, for us, they're separated things. So our provider has multiple screens open at once when they're in the midst of an encounter.
I can answer that too.
Oh, sorry.
That's okay. I think that's a big challenge, is streamlining all of that, right? For all of us, we have so much technology, at least I do. For our college-based and outpatient, we use Theranest, which is an EHR specifically for mental health. For school-based services, we use a variety of cloud storages. We use the school's platforms. We may enter our content right into their educational platforms, and so we're integrated in that way. But I think that there's certainly a lot more on the market, and it's really hard to figure out the one that works exactly right for you, and you have to try a lot of them.
So just to add to that question, do you have any advice? Would your advice be to just try multiple platforms and approach it that way? Any other tips on that piece?
Yeah, I know I have, and I know I have multiple ones for multiple reasons. I think that's a real challenging part, at least for me. I mean, I'm the sole owner. I don't have a tech company. I have a lot of clinicians that work for me, and I have infrastructure, but I don't have a hospital tech team behind me, right? And so some of the things that I'm geared for telling you is from kind of the bottom up, and trying those and looking for that automation. There's a lot of different things that are out there to help you automate. And it really has to be for ease of the user. Otherwise, they don't use it. Even getting access to your sessions. We all use, I've used Zoom for 5 years. And we use the link to get into a Zoom room, because special ed students aren't going to check their email to get a different invite each time. It has to be ease of use. So you need to know your audience that you're working with also.
Excellent. Thank you so much for that. We do have another question from the audience as well. Has anyone trialed mental health assessments in schools, elementary, middle, high school settings, not for therapy, but for assessment of aggressive behavioral, social media posts indicating suicidality, etc.? Anyone from the speakers want to jump in?
I can tackle that one. First of all, I could just say the amount of crisis that we've seen come through our schools has gone through the roof. We don't, particularly in schools, do formal assessments, but I can tell you that when I started with some of the cyber schools, they were really only doing virtual counseling, virtual speech, and a little bit of OT. Now every discipline, all school psychologists, functional behavioral assessments, anything that they do, everything went virtual, and most of it stayed virtual. And so they have adapted every element of what they're doing in that way. We do have crisis plans in place with every school. I put it in every contract. That's a great interview question. If you want to know if somebody's a good candidate, ask them, what is your knowledge of crisis in this situation or where you are? What would you do? That tells me immediately people, their knowledge. I can say that there are many students that I work with in our discipline that also have outside clinicians and counselors, and then we really need to work with them because school-based is meant to be more short-term. But they're absolutely, and I've had to create multiple forms of risk assessments that we use and a collaborative approach with the school, right from contract, even before we see the student, following best practices there. It's tough. And just to add to that too, even some of the partial hospitalization programs, which work with really intensive students, were all virtual this year in schools or outside of schools as well.
Excellent, thank you. Does Alana, Amanda, do either of you have any additions to that?
No.
All right, excellent. Thank you so much for sticking with us so far. We have another question that we want to make sure we touch on. Considering this session has the future of telehealth in the title in school-based settings, when considering your program, what do you see for the future of telehealth? And are there any challenges you anticipate in the future? Amanda, can we start with you on this one?
I think we've all benefited. I mean, everybody who's at this conference, if you're already doing telehealth, you've benefited from the pandemic in that you don't have to explain what telehealth is every time you speak to someone about what you do for a living, which is kind of awesome, right? Like people have heard of it now. It's become a household name. So I think we have, we're in a really good place there. I think to some extent we may end up competing with organizations or entities that weren't our competition in the past, right? Like the direct-to-consumer model is growing, and that's not only for adults. So certainly families may direct kids to that, or a kid could use their phone and connect to a provider. I don't know how the consents would work, but they could try. So there may be eventually some competition there that we don't really experience now. But I think what we're going to do is we're going to continue to stick to the school-based health model, right? And this is like these tenets of school-based health care that are about kids learning how to access care and having some autonomy, and about equity, and about care being available to every single kid at that school, regardless of their insurance status, regardless of their immigration status, regardless of their ability to pay. When we've had kids who are homeless, disconnected from their parents, but not emancipated, it'd be great to find a way to serve that kid. And I promise you, the Walgreens Minute Clinic isn't going to do it for them, and neither is the 1-800 I want a doctor on my phone. So, that's where we can continue to really scoop up the ones who would fall through the cracks otherwise. So I think that's where we're going to find our value, and that's where we may not always have, big volumes, implying that we have really big volumes now, which we don't. But we do see the kids who need us, and so mission accomplished. So we'll keep doing it. We'll keep being there to catch the ones that would fall through the cracks.
Fantastic. Thank you so much. Alana, do you have any adds for the future of telehealth and what you anticipate if you had a crystal ball?
Yeah, I think that one thing to consider is thinking about how some chronic diseases can be managed asynchronously. So not necessarily the traditional, connection face to face, so to speak. And so kind of just thinking through, particularly chronic diseases that there's a lot of value in having the parents be a part of that. And so I think that, kind of the blend of asynchronous and synchronous modalities for telehealth, I could see that kind of in the future.
Thank you. Brittany, anything from your end?
Sure. I think that I talked about it a little bit, but the introduction of other services. So, and the growth of the online schools, Pennsylvania, I think, we have like 200,000, online students, and just the growth across the country and the credibility that it now has, because the cyber schools in which I've been working with have really been pioneers. They're not just kind of adding on a little thing to a regular school system. And they're also now helping brick and mortar schools see this model and a blended model as well. I also think more of, what Amanda's doing too is kind of the medical model that's attached onto the school is part of the school, that's in the school is another piece. I definitely see challenges, and the challenges that I'm seeing just in the mental health field in general is, I think Amanda kind of touched on it, but it's almost like the Amazon of mental health, right? The kind of the corporate part of it. And I think that's affected some of the schools that we work with. As a licensed clinician that has been in this field for a really long time, and those of us in telehealth, there's so much fluff out there right now. There's great things. There is large companies. It's hard to decipher sometimes through that for the inexperienced person. And so I think working with the schools to really see that and see the value that we bring ethically, as well as with the experience that we have. I mean, I can't believe saying it, like, we're as far in and as many years in as we have been. And also the staffing piece. I mean, that's across the board, right? Nationally, finding the right staff and hiring in the right space is a challenge.
Excellent. Thank you. Yes, it has tremendously shifted. I can't believe 2 years has passed either. And it has become a very busy space for sure in the past 2 years. I know we are coming up just in the last 4 minutes or so of our session, but I do just want to touch and give the speakers one last chance to share any closing comments and any resources that you wanted to share before we close out. So Alana, can we start with you on this one? If you have any closing comments or any resources that you wanted to share with the group?
I think that a great resource is that there's the School-Based Health Alliance, which many of you may be familiar with, has a school-based telehealth playbook, and it's easy to find if you just Google that School-Based Health Alliance. School-based health playbook, and they do it does a nice job of kind of laying out different models of school-based telehealth and everything from equipment, and I think it's a great resource. I'm trying to think about what else it all covers, but that, and then I think in terms of closing comments, I mean, so I think I know this has been mentioned before, but just really thinking about how to streamline things for school nurses, I think is just so key. Really just making it as easy as possible so that she's ready to use the equipment when the time comes.
Excellent.
He or she, I should say.
Excellent. Thank you. Brittany, can we go to you next?
Yeah, I'm going to ask for Amanda's help on this one. I'm just wondering, for the people that are here, whether virtually in person, I should ask in the beginning if you guys are representing hospitals, if you're in schools already, just to kind of get an idea of who's here. And sorry to put you on the spot, Amanda, but can you see if you can get a little information from the group?
Yeah, well, I recognize half the people in the room. Not because they all work for me or with me, but I recognize a lot of people, but I don't know about everybody else. So hospital system, oh, that's like 4. Okay. And what else would that be? Like academic medical center, got 1, and other, and then community-based organization. Yeah. But there's 20-some people online, and I don't know what they're all up to. Oh, they're filling in the chat.
Okay, awesome.
I can see that.
Cool. Okay, I'm just curious because I had mentioned earlier about getting kind of nuggets of information. Somebody coined it golden nuggets, right? Even if this doesn't relate to you 100%, I always found that I could get those pieces of information and apply it. So I wanted to just share something that I've been doing. I have cloud storages, I have manuals, I have, we always try to disseminate all our information to our staff and contractors. So I just wanted to share, I'm a tangible visual person. So let's see if I can get my screen share on here. You guys got that?
Yes.
So this is just an example, and maybe what you can think about what you can do with your own programs. You might not have a tech company, a tech team, right? You may be in charge of your department or your school or whatever. I did this through Google Sites. I have a HIPAA compliant version of it. I use it for my team. Just as an example, this is for onboarding new clinicians, policies and procedures. They can log on and see who our team is, what they do, what schools we have. New therapists start here. We have onboarding phases that they go through. I have in here my telehealth best practices, and my favorite place to direct clinicians is this page right here. To go right to the matrix, there is a major hub of information right here that they can click into, and just taking all these snippets of info and making it available. Remember, even if you know telehealth, the people that are working for you may not, or you may not either, right? So just going through this, we blast our news flashes as far as information for our staff and give them a hub. through that and go through our policies and our programs. So my K-12, college, and outpatient programs. This could be potentially used as a client portal to disseminate information. It could be for onboarding staff, whatever. Just an example of something that my team has found very helpful, especially when you're doing everything remote. And as you know, we get tired of looking at things. So having something that's user friendly to me is really helpful, and for my team.
Excellent. Thank you. It looks like we are getting a wide variety from the folks online, anywhere from state-based AAP partnering with a hospital to academic med centers to community-based consortiums, so wide variety. There was, Brittany, a request to post the link in the chat, so folks could also check that out.
Yeah, I can't post a link because that links to private policy and kind of things that we wouldn't want to share. But I do have a sample. Like I do have a mock of that. So I can't do it today, but if I could maybe get it to the team and they can put it on the Matrix site, or I can send it out that way. And use, it's like an intro web. So what you need to do is you have to have a email through our company that's approved in order to get access to it.
Thank you, Brittany. And then last but not least, by any means, Amanda, any closing thoughts for you?
I think that we need to talk about school-based telehealth more. And I'd like to continue to see Matrix be a place that we can convene about it. And so I think I'm gonna have to volunteer for the planning committee next year. This is being recorded, right? So now I'm gonna be sucked in. So that we can really hear more. Like I've met a bunch of people this time who are doing school-based telehealth, and I'm really excited about it. I'm glad to have more and more in our region. So we didn't have any questions from here in the room, but I'm not going anywhere. So if any of y'all have anything else you want to talk about, I will stick around after we hang up.
Excellent. Thank you so much, Amanda. Thank you, Brittany and Alana as well. Thank you, Amanda, also for representing all in the room there.
Thank you.
And a huge thank you again to our speakers. Thank you to everyone for attending. The presentations, the brief slide overviews are on the session website, as well as, again, the bios if you have additional questions, as well as the speaker information if you would like to reach out. And with that, we will close for the evening. Thank you all again for being with us, and I hope you have a wonderful rest of the conference.